What are formularies and drug tiers in Medicare Part D? Imagine walking into a pharmacy and seeing a long list of medications. Now, think of that list as a special menu called a formulary. In Medicare Part D, a formulary is a list of prescription drugs that your Medicare drug plan covers. Each plan has its own list, which includes both brand name and generic drugs. These lists are made to give you access to a wide range of medicines needed for different health conditions. But remember, no plan covers every drug out there. The formulary can be different from one plan to another, even if they are offered by the same company. Medicare requires all Part D plans to include at least 2 drugs in each treatment category. For example, if you need medication for high blood pressure, the plan must cover at least 2 options. There are also 6 special groups of drugs called protected classes. These include cancer medicines, anticonvulsants, antidepressants, antipsychotics, HIV/AIDS treatments, and medicines for transplant patients. The idea is to make sure you have choices in these important areas. Now, within the formulary, drugs are grouped into categories called drug tiers. Think of tiers like levels on a staircase. The lower the tier, the less you pay. Usually, generic drugs are in the lowest tiers, making them the most affordable. Preferred brand name drugs are in the middle tiers with moderate costs. Non-preferred or specialty drugs are in the higher tiers, which often come with higher co-payments or co-insurance. These tiers help your plan manage costs and guide you toward more budget-friendly options. Medicare plans also use tools to make sure you get the right medications. These include prior authorization, which means your doctor needs to get approval before the plan covers a drug. Step therapy requires trying a lower-cost drug first before moving to a more expensive one. Quantity limits restrict how much of a medication you can get at once. These tools help control costs and make sure medications are used properly. Understanding your formulary and drug tiers is especially important when you review your plan each year during the annual election period. If your medication isn't on the list or is in a high-cost tier, you might want to switch plans. Sometimes, plans offer a transition process that allows you to keep taking your current medication temporarily when you change plans. This way, you avoid gaps in your treatment. In short, formularies are the lists of drugs your Medicare Part D plan covers, and drug tiers are categories that determine how much you pay. Knowing how these work helps you make better choices when reviewing or changing your coverage each year. It's all about making sure you get the medicines you need at a cost you can afford.